Hello and welcome to the Medical Sales Podcast, and I am your host, Samuel. In this podcast, I interview top medical sales reps and leading medical sales executives across the entire country. And it doesn't matter what medical sales industry, from medical device to pharmaceutical to genetic testing to diagnostic lab, you name it. You will learn how to either break into the industry, be a top 5% performer within your role in sales, or climb the corporate ladder. Welcome to the Medical Sales Podcast. Hello and welcome to the Medical Sales Podcast. And this week we have with us another special guest that I can't wait to talk about. But before I get into any of that, I want to address something head on. The Medical Sales Podcast was created really to create a very large community. A community where people in the medical sales space, and as I always say, medical sales meaning everything that medical and selling encompasses. So pharmaceutical, medical device, molecular, genetic, biotech, you name it. But it's designed to be a place where leaders can meet other leaders, job seekers can meet hiring managers can meet other sales reps can meet other sales reps, and sales reps can meet other leaders, and executives can meet other executives. And really this community where everyone can learn about everyone else and learn what they're doing and what their career tracks look like, what their leadership models look like, what they're doing that's bringing all the value to this field for the providers and patients that are out there. So in that community, a lot of things happen, and which is where my business comes into play, because what we do is we work with sales teams, we work with medical device companies, we work with pharmaceutical companies, we work with individuals, and we also help job seekers get into the space and people within medical sales transition into other roles. And we get the opportunity to really understand what it's like to go from one career track to another career track. And this week, we get the opportunity to sit with a nurse that's going to get into what it looks like to go from nursing to medical device sales. And this is great because I want to say at least a couple times a month, maybe every other week, I'll have a call with a number of nurses that want to get into the industry. And they have so many questions about, well, what is it like and what can I expect and what should I be going for and how do I even make it happen? So to have someone that's going to sit with us and get into the reality of that is a very exciting thing. Her name is Kelly Allan, and she's a clinical specialist in the neuromodulation space. And she's going to talk about what nurses need to be thinking about if they're thinking about making that transition into medical device sales. She's going to be talking about what skill sets nurses already possess that will make them effective in that role. And she's also going to get into what her day looks like. Now, following the tradition of 2021, this is another two-part interview. So you're going to need to show up this week to get good information, especially if you're a nurse and you've thought about this. And you're definitely going to need to show up next week to really get the follow-through and understand what you might be getting yourself into. So without further ado, thank you again for listening to the Medical Sales Podcast, and I really hope you enjoy this interview. Up right there, I'm going to let you introduce yourself. Why don't you tell us where you're from and who you are?
Sure. My name is Kelly Allan. I live in Boston, Massachusetts, and I work as a clinical specialist in neuromodulation.
Got it. And for those audience members that might not know, what exactly is neuromodulation? What are you doing in that field?
So neuromodulation is an umbrella term for many different therapies, but it is a way to modulate pain, to use electrical pulses to give the brain a different message so patients feel less pain.
Got it. And what's the schedule look like for someone like yourself in neuromodulation?
Well, it could be something different every day. The schedule is you could be starting your day at 6:30, ending at 7 p.m. or later. You could start your day at 10 a.m. and end at 2 p.m.
Got it.
It just depends on the day and depends on how you use your time.
Got it. So would you say that you can decide your own schedule, or are you at the beck and call of what happens in your territory?
That's a great question. It's more beck and call of your territory. Sometimes you have some control over your schedule, but it depends on operating room times, patient appointments, when customers need assistance or quotes or anything needed. It's just you are serving the territory and you are available most of the day.
Gotcha.
So it just depends.
And does it take your nights and weekends as well?
Not really in the nights. With neuromodulation, it's elective. It's not like a pacemaker.
Sure.
So you're not on call. But depending on who you work for, you're really not on call in the nighttime. So I usually stop taking calls anywhere between 5 and 7. And I do check my voicemail. If it's urgent, I'll answer it. But if not, I wait till the next business day. On the weekends, I'm not working. But there's an asterisk there because we do something called trial evaluations, okay, which I can get into later. But you might have to call patients over the weekend as well, which for me, I don't think has really taken too much of my time. I've put it into my lifestyle, so I'm used to it, and I feel like I don't work on the weekends even when I am following these patients.
Got it. Tell us a little bit more about the trial evaluations.
So a trial evaluation period, a patient is able to have a quick day procedure. They have the electrodes placed temporarily for about 7 days, more or less. They come back to the office on day 7 and they discuss with the doctor how well it helped them. Mm-hmm. Whether they did well or not, it is removed. But if they did well, then they can talk about having it implanted.
Got it. That makes sense. Okay. So we all want to know how you got into this. What brought you to neuromodulation? Take us back to college, because there's something that I want the audience to know. I'm not going to spill the beans, but you have a very interesting career track. So take it back to college. Let us know what you did going out of college and how you finally got to Abbott.
Okay, so I went to school for nursing at Salve Regina University in Newport, Rhode Island. I started my career as a nurse. I worked in a couple of different areas of nursing. I did work on a dementia unit. I worked in a long-term care. I worked inpatient on a cardiac unit. And then I worked in critical care in the ER. Mm-hmm. I had a preceptor who I looked up to so much, and she actually left to work at a surgery center. Mm-hmm. And she talks a lot, kind of like I do. So she gets to know people. Sure. And she met who is my current manager now. And she was asking her a bunch of questions, watching her program the stimulator, like, hey, what's this? What's that? What's the plus? What's the minus? What are you doing? And she's like, you seem really interested in this. Do you want to work for us? And she, talked about the career. And she's like, you know what? I'm trying to start a family right now. Not really interested, but I know a girl. So she gave her my number. Wow. And then she gave that manager's number to me. And so we set up for coffee. I met her and another girl on this team on a Saturday at a Panera. Wow. And we discussed, I did my homework though. Mm-hmm. I didn't really know much about neuromodulation, except when I did an MRI checklist in the ER, do you have a stimulator was on the checklist. That's all I knew. Yep. So I did my homework. I went in, I asked questions. They asked me what I knew about it and they were interested. So I went through the interview process. They really liked me. And then I was able to transition from a nurse to a medical device clinical specialist.
Wow. So, okay. So it sounds like you were invited to become a specialist as opposed to you were a nurse that looked for the opportunity.
Yeah. So it's funny. I just kind of put out there to people that I knew, like, I'm really interested in medical devices. It seems like, what everyone says, it seems like a cool career. You get to dress up, right. You get to work with doctors still, because, nurses are used to working with doctors. And it seems like the schedule is so much like easier. You don't have to work 3 12s overnight and you don't have to work weekends. So I was interested, and my friends knew that. My preceptor had known that. Yeah. And so knowing that, people knowing I was interested, they thought of me when an opportunity came up.
Gotcha.
So I'm really like pro, talk about what you want. Sure. Talk to your peers, talk to your supervisors, talk to anybody about what you're interested in, right. And they'll think of you at the right time,
I love it. I love it. So, I mean, I talk to a lot of nurses and that actually want to get into the industry. We have our program where we help people get into the industry. So talk to us about the differences between what you anticipated being a sales rep would be like and what being a sales rep is actually like having been a nurse.
Well, I will say having anatomy physiology was very helpful. Mm-hmm. When I did the neuroanatomy training, I was like, hey, I know this. This is great. But when you're in the medical device field, you're not acting as a nurse. Your role is not a nurse. You have to take your nursing hat off and put on whether you're a sales rep or if you're a clinical specialist, it's a new role and you have to start from the ground up. It's not easy because you're so used to it, right? You're so used to being part of the care team. You have input. I mean, not always, but the doctor usually, you have some input. They kind of listen to you. Again, not always. But as a nurse, it's different, right? You're doing IVs, you're getting blood, you're making assessments, you're writing notes, documentation is huge. And then when you go into medical device, you're no longer like direct contact. You're not touching the patient anymore. So if you have an assessment, you're not having that conversation with the doctor. So in the OR as a clinical specialist or a medical device rep, the things you would normally say as a nurse, you're biting your tongue.
How hard is that?
It's so hard because it's actually like for the nurses that have been nurses for a while, you're well known in your career. You have developed so many skills, and then you can't even use those skills anymore. So you kind of feel, what's the word I'm looking for? You end up feeling
like the fly on the wall.
Like the fly on the wall, almost like I went to school as a nurse and I learned all these skills.
I can't use them,
and I'm not even using them.
My hands are tied. Yeah. So okay,
like, I'll give you an example. So I watch the nurses put the IVs in. Yeah. And when I can't get it, especially now I'm like 4 years out of nursing. I feel like I still could put in an IV. Sure. But I was really good at it. So when
let me get in there.
Yeah. So when the nurses couldn't get it, I wanted to be like, just let me do it. But you can't do that. You just have to, watch them do their thing.
Right. I can only imagine. Would you say that even played into when you were in the middle of a procedure, you'd see something that maybe even the doctor did. And because of your experience, you kind of knew better. How do you manage it?
Yeah. Even like a recommendation for a type of dressing or a recommendation for like a medication. Yeah. Now that I've been here for 4 years and I have built relationships, the only thing I'm recommending is maybe the dressing. Okay. Maybe I'll say, hey, maybe you should think about this, but I'm still not recommending medications. I'm not recommending which vein they're using for the procedure for their IV. Right. Even anesthesia, you work closely, like physically closely to anesthesia for when you're in the OR, and you'll see vitals changing, and you want to give your input, especially as critical care, and you're like, have you thought about this? Have you thought about that? But you can't say anything, Oh
man, that's a challenge. So then what's it like for the doctors? How do they receive you once they learn that you've been a nurse? Be honest with us.
I wish I had a conversation with the doctor more in depth about this before you asking me, because unless you worked with that doctor before, I don't think it matters. Really? I don't think, when it comes to working with patients, they might think, okay, you have patient experience, which is a very good thing to have patient experience in this field. Just, to talk to a patient, how to have awareness around a patient, what you do say, what you don't say, how you update a doctor. But it really is about building relationships. Mm-hmm. So if a doctor doesn't know you, he doesn't trust you yet. You have to spend time, wait for time to pass, spend more time, show up, be consistent, and then they'll trust you. I would love to hear what another nurse in medical device thinks, but I think you could come from any background and almost get the same treatment, unless it really matters to a doctor. But across the board, it's really about building the relationship.
Gotcha. Besides the anatomy and just understanding the body and maybe a little bit more insight into how these procedures work, is there any other advantage you feel you have over someone that hasn't been a nurse that goes into a role like what you're doing?
So besides anatomy, and I kind of touched on this a little bit, but being able to talk to a patient, with neuromodulation, you have to, I said before, you don't have direct contact with patient, and that's speaking on like IVs and medication, but you do have to connect to their stimulator. Whether you're using a programmer or a magnet, you may have to touch them. So having that patient experience and awareness, someone who has nursing experience will say to the patient, hey, I'm going to touch your back here. Is that okay? And someone who maybe doesn't have a nursing background, they might not know to tell the patient, hey, I'm going to touch you here.
Gotcha.
Having that type of awareness and bedside manner. That's the word I'm looking for. Bedside manner. Nurses have.
Yeah, no, definitely. That's incredible skill to have, especially in doing something like this. Okay.
Definitely.
So not only are you had the background of a nurse and you're doing what you're doing as a clinical specialist, you are also a field trainer.
Correct.
So you get to teach other people how to do this role more effectively.
Correct. Yeah.
How has being a nurse played into that, and what you're training these new reps in doing?
Yeah. So when I was a nurse, I really wanted to be a nurse preceptor, and I wanted to teach new nurses how to work in the ER. I did start to get my feet wet in that and started to train people before I came here. So when I came here, I said, that's what I want to do. I want to do something when I get into medical devices, I want to do something that requires teaching. And what transfers over well is, let's see. So in nursing, you have to write care plans. You have to follow patients, and you have a diagnosis, and you have a plan on how to improve that patient based on that diagnosis. So it's a lot of organization, it's planning and understanding the person, like a patient, right? Every patient is individual. Every patient might have a little bit of a different plan. So when I train people, it's not the same every time. So I get to know the person. I get to know, I guess, what their diagnoses are. Where do they need help? And I come up with a plan.
That's good. That's really good. Okay. And how does that play out when you get to see people actually operate after you've trained them?
I love it. I love seeing people come in and have some gaps in either knowledge or confidence or covering a case, how to pack a bag, what equipment are you bringing? Because you can't forget anything. So it's really cool to see people maybe struggle or lack confidence and then get to a point where they're covering a case on their own, or they're seeing a patient by themselves and I'm not in the room with them.
Yeah.
That's pretty cool to see. That
is awesome. All right. So for all the nurses listening to this episode, give us in the best light you can, what are the if a nurse is considering getting into the field, right? What do they need to consider? I'm sure nurses make a lot of assumptions about what the lifestyle is going to be like. Yeah. That you now have the reality on. So go ahead, side by side, nurse to rep, what needs to be considered, what needs to be not assumed, so on and so forth. That was part 1 with Kelly Ann, clinical specialist in the neuromodulation space. Pretty insightful. Kelly got in a really interesting way. A lot of nurses I've talked to, and ones that want to get in don't get in the way Kelly got in, but Kelly really got in a really interesting way, and she got to explore an opportunity and took full advantage of it. One thing that she talked about, though, that I hear all the time is about nurses in her new role, in a device role, that overstep their boundaries because of what their experience was as a nurse. Kelly kind of put it out there that it's hard. It's hard not to do so, especially when you see something that you really know and believe you can correct. But as a sales rep or a clinical specialist, and you being the representation of whichever employer, you of course have to mind your P's and Q's, and you can't do anything to even make it seem like you're undermining the provider or the staff. So it's imperative that anyone that thinks about getting into this space can exercise the discipline to make sure they're not overstepping their boundaries. Because again, this is a complaint that I hear on a regular basis that nurses that have become reps sometimes make the mistake of doing. She also got into the bedside manner and how helpful it is to have such a strong, for lack of a better phrase, bedside manner acumen that really helps her as a clinical specialist communicate with her patients. And you can see, and she even made the distinction that when it comes to someone that doesn't have that type of background, sometimes they fall short on effectively communicating with the patient. So it can go a really long way. I'm not going to say too much more about the interview because you're going to need to turn in next week for part 2 to really hear about the rest of what Kelly has to say regarding what the day-to-day actually looks like. But what I do want to address, and what I do want to challenge any nurse that's listening to this episode, really think about why you want to make the transition. What is it that you're after? Because when Kelly really gets into some of these things, I think there's a lot of similarities to what you're already doing that you're not going to stop doing. One thing that she pointed out, actually, you know what, I can't even tell you because that's next week. But one thing I want you to think about is why do you want to get into this? Why do you want to get into medical devices? That's the first thing. Or into any other medical sales. Why do you want to do it? What advantages do you really think you're going to have? And I'll take it one step further. What don't you like about what's happening right now in your nursing career? And I don't mean this the general complaint. Like, right now we've all had a very tough time, and I can only imagine the incredible challenge it's been for nurses and doctors, really. But if you were to go back to any level of normalcy, and you thought about your role as a nurse, what is it specifically that you want to change that's even having you entertain a position in medical sales? Again, thank you so much for listening to the Medical Sales Podcast. Please come back next week so you can get the real lowdown on what the transition looks like from Kellyanne when it comes to going from nursing into medical sales. And for those of you that are thinking about getting into the space, or you're in the space and you want to make a transition within the space, you want to go from pharmaceutical to medical device, or medical device to genetics, or genetics to biotech. If you're that person and you're thinking about, I really want to make that transition, I want to do it well, and I want to do it as soon as I can, what resource can I go to? Where can I get some help? Where can I just learn how to get it done? Or maybe you've been trying to do it and it's just not happening. Then again, you need to make sure you visit evolveyoursuccess.com and select medical sales role or medical sales attainment. Or you can see me at LinkedIn, Samuel Gbadebo. Just reach out, send a text or a direct message and let me know that you're interested, and we'll connect you to one of our client specialists and we'll get you on the path that you should be on. As always, I appreciate everyone that listens to the Medical Sales Podcast, and I hope you come in next week and stay tuned for another episode. I hope you enjoyed today's episode. And remember, I have a couple programs that show you exactly how to break into the medical sales industry, become a top-performing medical sales professional, and also how to masterfully navigate your career to executive level leadership. Check out these programs and learn more at evolveyoursuccess.com. Stay tuned for more awesome content with amazing interviews.